Perimenopause and vision, the unseen shift. Sight is something we rely on instinctively. Every screen we read, every message we process, every decision we make. For many women, however, vision begins to change quietly during midlife. Not suddenly, not dramatically, but gradually. This is the unseen shift of perimenopause, a biological transition that affects far more than hormones. It reshapes vision, mental clarity, emotional resilience, and daily performance. For women between the ages of 35 and 60, perimenopause often arrives during a peak season of life. Careers are advancing, leadership responsibilities are expanding, families rely heavily on their presence and strength. And yet, changes begin to appear that are difficult to explain. Eyes feel dry or irritated. Vision fluctuates throughout the day. Screens become harder to tolerate. Light feels harsher than before. Focus fades faster. Mental fatigue sets in earlier. These experiences are frequently dismissed as stress, aging, or workload. In reality, they are often signs of hormonal changes affecting the eyes and brain. Perimenopause is not a moment. It is a phase that can last several years. During this time, levels of estrogen, progesterone, and androgens fluctuate unpredictably. These hormones do not only influence reproductive health, they play a crucial role in tear production, eyelid gland function, ocular surface stability, blood flow to the optic nerve, and how visual information is processed by the brain. When hormonal balance shifts, the eyes are often among the first systems to respond. Many women notice burning, grittiness, or a sensation of dryness that does not improve with blinking. Vision may blur intermittently, especially during prolonged screen use. Contact lenses may become uncomfortable. Driving at night may feel more difficult. Reading may take more effort. These symptoms are not trivial. They are not imagined. They are physiological. Dry eye disease is one of the most common and under-recognized consequences of perimenopause. Hormonal changes reduce the quality and stability of the tear film. Oil production from the eyelid glands becomes impaired. Inflammation of the ocular surface increases. The result is not simply discomfort, it is visual instability that interferes with daily function. For professional women, this translates into reduced concentration, slower reading speed, decreased accuracy, and mental exhaustion by the end of the day. Vision and cognition are deeply connected. When visual input becomes unstable, the brain must work harder to interpret information. This constant effort contributes to brain fog, reduced processing speed, irritability, and emotional fatigue. For women already navigating hormonal fluctuations, this additional cognitive load can feel overwhelming. Perimenopause also influences long-term eye health. Estrogen plays a protective role in ocular blood flow and optic nerve health. As estrogen levels decline, vulnerability to optic nerve damage may increase, particularly in women with additional risk factors such as family history, cardiovascular disease, diabetes, or certain ethnic backgrounds. Conditions such as glaucoma often progress silently, without pain, without early warning signs. Many women discover glaucoma not because they notice symptoms, but because it was detected during a routine eye examination. This is where optometrists play a critical and often life-changing role. Optometrists are frequently the first healthcare professionals to identify perimenopause-related changes in the eyes. Through comprehensive eye examinations, they assess tear film quality, eyelid gland function, eye pressure, optic nerve integrity, and visual performance. They detect early dry eye disease. They identify subtle optic nerve changes. They monitor glaucoma risk over time. They recognize when hormonal shifts may be influencing visual symptoms. When glaucoma or other serious eye conditions are suspected, optometrists initiate timely referrals to ophthalmology, ensuring patients receive specialist care without delay. Optometrists also support long-term management. They monitor disease progression. They assess treatment effectiveness. They guide patients through lifestyle adjustments, visual ergonomics, and treatment adherence. Modern optometry is not simply about prescribing glasses. It is preventative health care. It is early intervention. It is whole person care. For women in perimenopause, this partnership is essential. The impact of perimenopause on vision extends beyond physical symptoms. It affects mental health. Unexplained visual discomfort can erode confidence. Fluctuating vision can create anxiety about performance. Persistent eye strain can contribute to feelings of overwhelm and loss of control. When women begin to question their focus, stamina, or efficiency, self-doubt often follows. This is not a reflection of capability. It is a reflection of biological change. Vision challenges also influence family life. Energy levels fluctuate. Evenings feel more draining. Daily routines require adjustment. Partners may notice changes before women do. Children may sense reduced patience or increased fatigue. As independence feels less certain, emotional strain can quietly build within households. Understanding and support become vital. Perimenopause also has a measurable impact on productivity. Vision fuels performance. Clear, comfortable sight supports efficiency, accuracy, and confidence. As visual comfort declines, work becomes harder. Screens strain the eyes. Reading takes longer. Mistakes feel more costly. Fatigue accumulates. For some women, careers are interrupted or reshaped prematurely. Opportunities may be delayed. Leadership confidence may waver. Protecting vision is not just about comfort. It is about preserving purpose, contribution, and professional identity. Eye health does not exist in isolation. Nutrition plays a critical role in supporting ocular and neurological health. Adequate intake of essential nutrients supports tear production, retinal function, and brain performance. Cardiovascular health matters. Blood flow to the eyes and brain is vital for long-term visual stability. Stress regulation matters. Chronic stress exacerbates inflammation and worsens both dry eye symptoms and cognitive fatigue. A lifestyle that supports the brain also supports the eyes. This is why comprehensive eye examinations during perimenopause are not optional. They are preventative. They are strategic. They are empowering. Early detection allows timely intervention. Targeted dry eye therapies can restore comfort. Visual ergonomics can reduce strain. Monitoring optic nerve health can prevent irreversible vision loss. When care is personalized and proactive, women do not have to accept decline as inevitable. Perimenopause does not signal weakness, it signals transition. With awareness, expert optometric care, and informed lifestyle choices, women can maintain clear vision, mental clarity, and resilience. Seeing well supports thinking well. Thinking well supports leading well. If you are a woman over 35 experiencing changes in your eyes, focus, or visual comfort, do not ignore the signs. Do not normalize discomfort. Do not wait for symptoms to worsen. Book a comprehensive eye examination. Speak to an optometrist who understands perimenopausal eye health, because protecting your vision is protecting your future. Eat well, see well, live and lead with clarity.